yeah, there we go. So yes, somebody can be reinfected, but most of the time, or with some people, they can build up a tolerance or some type of an immunity to it. In regards to testing, anyone who's had 3 or more days of diarrheal stools can come to the health department. We have testing kits available. We are open Monday through Friday, 8 to 5, closed from 12 to 1. So we've offered that. Anybody can come by and pick that up.
What do you do if we come and we have, what do you do?
So
Go to the doctor and get pills that we can't afford, that we don't have money for?
So if you come in and you come to the front counter, we will give you the kit that you need to go home and do the specimen. There's instructions on how to collect a specimen. You bring that back to the health department. We send it to the Oregon State Public Health Lab. When they get the results back, we'll notify you of the results. But that's between you and your doctor as to regards to the treatment. Can you raise your hand so I can see you?
How long will you test positive for? If you go in to be tested, how long are you still going to test positive?
And that I am not sure of how long the parasite stays in the stool. I'm unsure of that amount.
And another question is, you guys sent forms to the governor, right, for help?
For declaration of emergency.
Emergencies. Okay, so now is the 15 confirmation people that have been ill, is that all that he's going to see? And are you going to do a survey to show that other people have been ill?
No, that's not all he's going to see. His staff are the people that we're working with, the epidemiologists and the Oregon Health Authority. They work for the governor, so the governor's going to know. And the way we're framing it with the governor is the economic impact that it's had. This is really no different than a huge snowstorm, a tornado, a drought, or anything like that, any other emergency like that causes an economic impact on the county. So that's what we're talking with the governor about.
She said that we could go and get a test, right? And then we would be between our doctors, and that's what if you can't afford to go to the doctor? And if you go to the doctor and they want to give you these pills, that's fine if you got the money, but we live on a very, very tight income. We can't afford to go to the doctor. I can't afford to pay that type of money for 4 pills.
Well,
what do I do, just stay home and suffer?
Well, I have some personal experience with Cryptosporidium, and the doctor will tell you that the pills won't be any good. What the pills are for are people who are whose immune system is compromised and who are at most risk of becoming seriously ill or dying from this. Those are the people that they want to have the pills. Healthy people, the pills do no good except maybe help you with your nausea and your diarrhea, but they don't. There's nothing that can kill the parasite.
I've heard a lot of reports from people that have gone to the hospital and not been admitted. The staff at the hospital just tells them, okay, this is what you've got. We're sorry. It's going to take its course for the next few days, and just, drink plenty of fluids because it's going to dehydrate you. So even the hospital admits that there's really not much they can do for you. Unless, you get completely dehydrated and you need IVs and that type of stuff. It's just one of those, it's just like the flu. It's basically a lot like the flu. You're going to get diarrhea, you're going to feel like crap, and it's going to take you time to get over it. And a lot of the people are being infected from other people. It's not just the water that's infecting. That's why the swimming pool has been shut down, and they've decided to do the maintenance right now because it's really not safe to be open. There's been a lot of communities, if you look on the web, that have had major outbreaks from this, and it's been traced to a community swimming pool.
We have schools starting here in the near future, with these children coming to school, perhaps they need to be tested before they go to school, just like an immunization, if they're passing it between each other.
Is there any effective way to check for this?
That's why we're encouraging hand washing. So hand washing is a really good way to prevent this
And
from
as
secondary
every
spread.
parent knows, your children do not wash their hands for 20 seconds under hot water. They
And the
go in
schools
there,
don't
they
even
rinse
have
off,
hot
and they
water.
go. So how are we going to make sure that the children don't have it before they go to school?
And you may make sure that your children do, but what about your neighbors or town and block place where they don't? You're just gonna be passing it all around to everybody else.
Yeah, I can't really answer that specific question and say that, we can test everybody before they go to school, because maybe everybody's negative when they go to school and then something happens. All it takes is one person. So it's really good, we need to teach our kids good hand washing, keep their hands out of their mouths, all that stuff. And I do have 2 young children myself, and I run into that also. So it's just an education piece with our kids, and we all know when you have little kids, you fight an uphill battle about hand washing and, wiping their nose, picking burrs, all those things. It's just kind of a normal thing when you have kids.
Sam, if you could give us your name and address and your question.
Stand back, I'm reading my question, I'd like to make a statement. 2459 King Street. I get a lot of questions here that, what can you do for us? These guys have been working their butts off, trying to give you good water and everything else. And some little bug comes along, slips in, 14 people get sick, and the whole town's panicking. They're doing everything they can to stop the problem.
We're really not here for political.
I know, it's not for political, but I'm talking about some of the reactions we get here. I drink the water every day, 6 glasses of water every day. I don't have a filtering system. I just drink it right out of the tap. And I haven't had any problem.
Yeah, good for you, Sam. Good job.
I'm not panicking.
I have talked to quite a few people in the community. My wife works for a outfit here in town who is kind of a closed community, who are not privileged to drink bottled water. They have been drinking out of the city water up until the boil order came in. Multiple people there came into their facility wondering if they were sick, showing symptoms. They took 12, I believe it was 12 samples. None of them came back positive. There are other bugs going around our area that present a lot of symptoms that are identical to the Cryptosporidium. I'm just like everybody else here. I feel awful for those who are sick. I have lots of friends that have been sick. I have friends that have been tested positive for the Cryptosporidium and those that have not, that were tested and it was negative. But I do know there's a fairly big flu bug going around, there's a cold bug going around, and I've even known a couple of cases of pneumonia. So we need to remember that all of this, I mean, for those that are sick, I do feel sorry for it. I know it's miserable. But we need to treat this just like any other flu epidemic, any other cold epidemic, especially with the kids going to school. I have 2 that are going to be attending school this year. My wife and I have been really teaching them a lot, especially lately, how to wash their hands correctly after they use the restroom, after they sneeze, after they cough, to help keep the bugs to a minimum, even in our own home.
Linda Wall, 1105 Place Street, and I too have had crypto symptoms since the 17th of July. I know that date because it was just 2 days before we left on a vacation, and I had it for 2 weeks, and I was actually relieved until I came home and found out there was a reason. But now I'm really ticked because I think it's a really poor reason. I am just wondering how many here in this audience tonight have had crypto symptoms. I think it would be really interesting to find out. Okay, thank you.
How many was that? How many was that anyway? Oh. Okay.
Is your name and address for the record, please?
Yeah, my name is Jeff Strong, 92 3rd Street. And I have a couple questions. One of them is with the UV that we're, what is it, the LT1 system, I think it is? Okay, it's 99.9%, I'm guessing, the UV. Is that correct? Because that's everything I'm looking at for filtration systems, are you always like 99.9? Nobody wants to say 100%.
Okay, the 99.9% inactivation is what the rule requires, okay? And that's typically what the ultraviolet system is set to achieve at least that at all times, okay? Sometimes it may actually achieve a little more than that. A filtration plant, depending on what kind of plant it is, can remove more than that. Like the latest technology in filtration is membrane filtration. And some of those are rated up to 99.999% removal. So there are other technologies out there, but for the way Baker City's water system is set up right now, the federal rule requires that 99.9% activation if you're going to use ultraviolet.
I don't know if you know this, but the UV, when you actually treat the UV, I read that it can actually, it inhibits it from reproducing.
Correct.
It causes you to be sick. And it said that when you use UV treatment, it can actually, it'll heal itself. You know the amount of time usually it takes for it to actually fix itself and start reproducing again, the same cells?
Okay. I know the ultraviolet damages the DNA
Yes,
that's in the parasite, so you're right, it can't reproduce. I frankly don't know about the DNA's ability to heal itself. I've not read up on that, so I really can't answer your question.
Yeah, I was just thinking maybe, what's the life cycle? How long does like one otis or osis, how long can they actually last? Is it like a month?
Well, you know, I wish I knew more of that. I know that once your body sheds them and they're in that cyst form with that protective shell around them, they can remain viable for months. So it's some length of time they can exist in nature, on the ground, wherever they happen to land or be. And if they're ingested, they will react and become active.
Yeah, this is water, because if you get a UV plant here, and say some people like to store water, or just in case like they ever need it or something, in their cars or something. They might, like, I don't know how long it would take. I couldn't really find a straight answer on the internet either. Because I guess, I don't know, there's not very much technology that knows about all this stuff yet. We're just going into it. But it's saying that the UV would actually repair itself, so you wouldn't be able to store water in Baker City and be safe with it. And going in, like, I don't know, I know you're an engineer, you're not a big biology person. And another thing that I ran into is, I was looking at the glacier water machines, like at Safeway, Albertsons, and they were all shut off and everything. I looked up the technology and everything. It has UV as the fifth step. It also has a micron filter, and it also has a reverse osmosis, which goes down to, I think the OSIS, they are usually 4 to 5 microns big. And it said that the reverse osmosis goes back to 1/10 of a thousandth of a micron. So we literally get everything out of there. Yet the state of Oregon told them to turn all of them off. And then to add on to that, they have Sterilox at Safeway and Albertsons, which kills 99.9% of it, using electricity and salt in a saline solution, which they sprayed on all the produce, but the state of Oregon still made them throw all that away. And I think Safeway said when I asked the manager about it, they're paying $2,800 per day for a water truck to come in to give them like good water from another source, probably $1,000 or something like that. And like, where does it meet the requirements for the state before they can say 99.9% is not good enough? Like, is the filtration systems that the city is looking at, is it better than 99.9%? Like, what's the criteria for that?
Okay, there's a lot of questions in there. Okay. The city had a couple options of either installing the UV treatment, which does not filter the water. It does not actually physically remove any of the cysts. They just, their DNA gets damaged and they pass right through and go out into the water supply. Okay. Or the other option was a filtration system, which would physically remove them from the water. Okay. And the city decided to go with the ultraviolet treatment system. Okay. And it meets the rule. And that is just deemed safe enough by the EPA, who writes the rules, and it's based on a lot of scientific research. Okay. As far as shutting off the water machines and getting rid of the produce, when there's an outbreak like this, we're probably overly cautious because we want to make sure, if at all possible, nobody else gets sick. So it's just being extra cautious why they need to throw that produce away. And as far as shutting off those machines outside, I'm really not familiar with them. If it is treated with the approved types of treatment units that the state recommends or the CDC recommends, it should be safe to drink. So, whoever owns those machines could request and the grocery stores, I think the licenses are issued by the agriculture department.
Yeah, I talked to Kelly Bench in Ontario.
Yeah.
He's the food safety coordinator.
Right.
At the,
So they could request he take a look at that specific case, and he could make the determination whether those can be turned back on or not.
Yeah, when I talked to him on the phone, he told me that no filtration system at this time was good enough for the state or Baker City's crisis that they have right now. No filtration system is going to work. I was just wondering if Baker City was I think it's $16 million or something for the filtration plant that they're looking at, would that still be good enough for their criteria since none of the other things are good enough?
Yeah, I'm not sure what question he answered that to, but
I just
a
asked
filtration
if
system.
filtration would work, and he's like, none of them are good enough right now. Like, none of them would work for them right now. They just said boil your water or buy bottled water. That's all he said.
Yeah, well, in the very first hours and days of this whole incident, we were being overly cautious because that is the most safe thing to do, is either boil the water or drink bottled water. So as we had discussions and conversations amongst the different agency staff, we are now allowing facilities that have some filtration units or reverse osmosis units that meet the NSF treatment standard to use that water. Like as one was mentioned was that ice house. They're back to, I believe they're up and running right now, I believe. And they have their own filtration system, in their facility that is considered adequate. So there are some that are operating with their own filtration system.
Okay. And to get you off the hot spot, obviously. This question for the city. I was looking at the budget for their 2012 to 2013, and the city's budget put $140,000 on a UV treatment plant. I was wondering what could come out of that. Did they get a location for it? What did they do that $140,000? And it was a proposed $230,000 this year. I know after this year they're planning on getting bidding going. I was wondering.
Right, so we have done the preliminary work. Again, it's not like you just order one off the shelf and put it in. So those dollars are for the preliminary design, engineering, the piping design, the building design, all of that. We've actually gone out to bid and selected the Wedeco equipment that we plan to use. And so we went through that process. That process includes not only selecting that equipment, but it has to go through a validation process. And there's a lot of reviews, not only with our engineering firm, but at the state level. So it's those types of things, preliminary work. Yes, we have a site selected. Yes, we have a building design selected. Yes, we have equipment selected. No, we have not constructed it. So that's the type of thing that we're spending money on.
Okay, my final thing is in the budget, is I think the counselors make something like $1,000 all combined a year. Is that wrong? That's what the budget says.
$150 a piece.
Yeah, $150 a piece, so 1,000 combined is what I meant. So I commend you guys, but at the same time, I just got out of the Army for 4 years, and I was deployed and everything, and they say the first thing is initiative. It's the first thing you do. You got to prevent. So when you knew that it wasn't you that was the mayor at the time, it was Mr. Dora, I think, or is that his name? The one that owned yours. He said that he wanted to wait on it, and I can understand that. It gets cheaper over time and everything. Technology developed. But I think that the city, they knew that crypto was somewhere in the water, even though it's really small traces. I think that they should have been testing for crypto, even though it's not required. Like, there's a lot of things that aren't required of us, and we still go out and we do it anyways. The city, I think, should have took initiative and actually tested for crypto instead of waiting until something like an outbreak came out. That's just how I feel. That's how they taught us in the Army, this initiative. And it seems like there was no initiative on this. It was like brought up at the city council meetings multiple times, and they kept on saying, let's wait on it. They even got a 2-year extension for it. Even with that 2-year extension, I completely understand that for money's sake, but it's just the fact that it hasn't been tested. They tested for the E. coli and bacteria and like arsenic and all that other stuff, but they never tested for crypto. And I just couldn't figure that out. Like, even if it's small traces, if there's traces coming from something, they knew it was in there. Why weren't they testing it?
This last statement, I couldn't agree with it more. The city knows that there is crypto in the water, and the excuse that they haven't been testing for crypto is it's just too expensive. Well, I don't think the health of the community is too expensive. And from now on, there will be some serious crypto testing. One of the things that we've been criticized for putting off getting this UV in place. The crypto levels that we found, there was no reason to have it in place. And technology and everything changes every day, so we have been trying to put this off a little bit. To give you an example, at the last council meeting, the DEQ came, and the city's been working since 2005 on getting rid of the affluent water at the sewer lagoons differently. So since 2005, we've been working with the DEQ, and we've been jumping through all their hoops and doing everything they wanted to do. The last meeting, they came and said, well, the way we were going to have you do it, we decided we don't like that plan anymore. But don't go out and do another plan because we're not sure what we want you to do now. Now, this is a federal agency or a state agency that the taxpayers spend billions of dollars on, and they haven't got a clue as to what's going on. And so it's really frustrating for small towns like this to have to deal with these government agencies that you jump through all their hoops and they're not happy. They change their mind from week to week. So, we plan on having the UV in place a year ahead of time. Now, because of this, we are going to look at other options. We're going to look at getting things in place quicker to take care of this.
Hello, everyone. I'm going to try to address a couple of the things that the gentleman that was up here before. I'm not a member of the community. I'm a program manager with the Oregon Department of Agriculture. We are the ones that regulate the grocery stores and the food processors. When the information first came to us, the information was that the city had issued the boiled water notice and that residents and businesses were recommended to use boiled water or bottled water. Subsequent information came that the filters would be acceptable. I had conversations initially with Safeway safety managers, and it was a joint decision that they would rather be safe than sorry by removing all of the produce all of anything that had been misted with the water prior to this event, and that they would replace that. They then continued misting with bottled water. So out of an abundance of caution, it was agreed that we needed to do those things. The ice house, yes, I believe initially was shut down, but once we learned that they had one of the acceptable filters, being the absolute one of the filters that were listed on the CDC website, we allowed them to go back into production. We are working with other facilities to try to, maybe we can't get them 100% back into business, but we are trying to do baby steps. That's the best that we can do right now. We're working with the epidemiologists, with the state. So if that answers some of the questions that the gentleman had over there. I am not aware of the the water bottling stations in those facilities, whether they are adequate or not, because the only information we are using is the CDC 3 approved filters. Does that answer your question?
Yeah.
So that's kind of this.
They told me that they use Sterilocks, the company called Sterilocks. And Albertson's manager, he said that he called them up and they're not guaranteeing it. So
Right, so if they're not going to guarantee it, the stores are not going to risk that. And I will commend the stores because they are going above and beyond and trying to make it.
How well regulated are machines like Glacier Water in terms of the maintenance that's required to keep them functioning properly? I'm just wondering, I mean, I could see going with an abundance of caution if you weren't aware of how well those machines are being maintained. I don't know if you are or you're not.
Well, those machines are basically adding an extra layer, from my understanding, to what the city water is. So, some
But
of us
who's
have-
maintaining them?
It's the stores. It's the store's responsibility to maintain them.
But you don't know if they're maintaining them properly. When I was down in Arizona last winter, a store manager told me, yeah, it's broke down again because they haven't been maintaining it. So all I'm saying is that it's an issue.
Okay.
Oh, and it supports what you did, actually. Yeah.
Thank you.
Yes, I'd like to say that Safeway should really be commended because it's really taking the reins on this. They immediately put in a filter system. They are in the process of putting in their own UV treatment, water treatment system for the store. And they're going to be completely impervious from anything the city does.
One thing I haven't heard anybody say, just we ought to be thankful that there's trucks of water that come in from other places that we're free to use. And if you don't use it, it's tough luck.
Yep. The city has provided water trucks.
We've got 2 separate water trucks at Campbell and Grove on that corner. We have a 3rd water truck right now at the Baker County Fair, providing drinking water for everybody at the fair. A separate water truck is providing stock water for the animals. So there's one in the front. So again, we are trying to meet the needs of the community. We are very thankful to the city of LeGrand and the city of Haines. We got the initial trucks from the city of LeGrand. They cleaned the city of Baker City's truck and filled it with LeGrand water. And then the refills, we are just going to the city of Haines and getting their water. And so we're very appreciative of that. And